Welcome. I'm Dr. Miller with Integrated Health's Medical Minute, and we're looking at the blood urea nitrogen. As I said in the short, the normal range for this is between 7 and 20 milligrams per deciliter. Optimal is 10 to 16 milligrams per deciliter. We want those tighter ranges. The tighter the range, the healthier you are. So how do you know if BUN needs to be actually looked at? We start to look at the clinical manifestations. What symptoms are you having? And if we start to see fatigue, confusion, increased urine output, and heart palpitations, that's showing us that the electrolyte imbalance is starting to happen. Those are definitely things where we want to start to look at the liver and the kidneys and seeing how they are doing and giving them some love if they need it. So if your BUN is decreased, so the blood urea nitrogen is below that 10, we can really start to get into correcting things before they get bad. And this could be because of malabsorption. And going right along with that is intestinal hyperpermeability. So if you are of the medical vein, that is how they renamed leaky gut. They didn't want to say leaky gut was a real thing. They started to say it's intestinal hyperpermeability, which, if you watch the short on our video page, we have a thing from Microbiome Labs, and that actually goes into what intestinal hyperpermeability and leaky gut is. The other things that can actually make this go low are low protein intake. So if you're not absorbing it or you're not getting it in, both are going to show you that you have low protein. Pancreatic insufficiency, posterior pituitary dysfunction, and liver dysfunction or liver issues. And you also correlate the BUN to ALT and AST. This helps with getting an overall look at how the body is doing. The problem is by the time it gets to the blood and the blood values start to go awry, there's a lot of damage there typically. And so the earlier you catch this stuff, and that's why we look at optimals, the better off you are. And so indications, if the BUN is high, dehydration is number one. Hypochlorhydria. So on the previous slide, we talked about malabsorption and intestinal hyperpermeability. When we look at hypochlorhydria, the thing that happens with this is the stomach acid, whether it be decreased due to an H. pylori infection, or maybe you have some sort of issue with biofilms not allowing things to happen. The ability for the hydrochloric acid in the stomach to do its job becomes impaired. And then we start to look at kidney, renal insufficiency and diseases, anterior pituitary dysfunction, dysbiosis. The dysbiosis also correlates back to the hypochlorhydria, because if you don't have that acid in the stomach, the bacteria, when they come up to the pyloric sphincter, if they don't sense that the hydrochloric acid, the environment in the stomach, is too acidic, then they can spill into it, and then you get problems. And we call that SIBO, small intestinal bacterial overgrowth, excessive protein intake, edema, which is swelling, and then last but not least, adrenal stress cortisol. Stress is such a killer. And a lot of times people don't realize that the car accident that affected them 20 years ago, or the death of a parent, or the divorce or death of a spouse, those stressors, if you don't adequately deal with those, become a much bigger issue. And so we really also like to look at that. I rarely will take the blood work by itself, because you get a little bit of a picture. But like I said, blood work is typically a very late stage metric. If the body is allowing things in the blood to get way out of whack, there are a lot of upstream problems. So if you need help with any of this, or you have questions, here's our contact information. We are happy to help. We're happy to answer questions. And as always, we look forward to seeing you next time.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.